We are rolling.
Okay, so coming back to now that the VCL it's completely cured, okay, it's time to give the shape to my handle, my tray handles. As Dr. Van put on his, he make a little twist, and the only thing we have to do on this one basically is shape it this way, so when we're holding on my patient's mouth, this will be away from my border molding, okay? On this one, on the one I made, you can either put it like Dr. Van did, or you just make two bends like this. You see? Now we will have the same position and the same way of using it. On the upper, what we really want is to have something where we can always grab it, okay, in a more efficient or stable way, just like this, okay? Now, this has cooled down, and now with the aid of my buffalo knife, I'm just gonna take it off. And you will see how now I have my wax in here. If you just taking this out from the triad unit or the curing unit, this is gonna be extremely hot and it's gonna be very hard for you to take it off. So I recommend you to let it cool down and then get it out. Now that it's cold, you'll see how easy this will peel off. Well, not so easy. But what we need is, we need all the wax of the tray, okay?
You're gonna do to put it in the boiling unit anyway, and just to
You can
get the wax off and the oxygen inhibition layer.
exactly. So as Dr. Van is saying, I want to get as much as I can with my knife, and then we're gonna put it in the boiling unit. But I want to take at least the majority of it with the knife. Be careful. And then the rest of it, then we'll boil it up, and I'll show you how it works. Okay. And remember, like as Dr. Van's saying, there is, with any composite, and you'll learn it in your operative or whenever you're dealing with composite or with light cure materials, you would always have an oxygen inhibition layer of material that would not be completely cured. It's very important that we find out if our materials are compatible or not with this oxygen inhibit layer. As far as it goes with our impression materials on BPS or polyether, we need to wipe out that oxygen inhibition layer. And you'll see what I'm talking about. Once you take it off, you will find a gooey looking or feeling layer all over the place that we need to spray it out, either with the boil tank unit or with some, okay.
Alcohol gauze will work good too. And it doesn't taste very good either.
It doesn't.
Remember, you're putting this in the patient's mouth.
You're right.
The mannequin doesn't mind, but the patient does.
So this is basically what I have. Let's go with the lower. Again, take it from here. Okay. You have it. What do you see? Buckle shelves, tissue stops, and everybody very well copied. Look, in this case, it's coming out a little bit more clean. And that's what we're looking for, okay? Some of you will be lucky enough to not have it so much stuck, and you guys, some of you will have to really work on it, taking it out, okay? Pretty much I took this one out. Let's see what Dr. Van did. It's also right there. All right. Let's go to the boil out tank.